Move on to talk about who can get a dental implant. Now we know a dental implant is meant to replace teeth. Let's talk about who can actually have a dental implant. So it's not as simple as somebody with a missing tooth. They're automatically a candidate for a dental implant. There are a little bit of list of requirements, and mainly it's a lot of it is health related. So this goes back to our very first module about having a good system in your dental office and really look at the patient as a patient. And we have to know their medical history, we have to know their social history, we have to know their dental history for sure. But we really need to have a deep dive into their medical history, and having known their medical history, their family medical history, and as well as what kind of medication that they're on. So that is a very huge part. And dental implants has a higher failure rate in those who are not healthy and compared to those who are healthy. So what's my criteria? We place implants in patients all the time, and I have a few hard criteria. One of them is uncontrolled diabetes. If you cannot get your blood sugar under control, I don't feel comfortable, recommending an implant for that individual, because it's risky and it's most likely going to fail in the long term. The other part is use of IV or oral anti-resorption medication or bisphosphonates. And the third one is osteoporosis. And the last two kind of connects to each other. And so as we get older, especially more common in women than men, as the hormone levels change, our body actually starts resorbing some of the bone, and our bone gets thinner and a little bit weaker. And so when you have, and we call that osteoporosis. And sometimes when a doctor sees an individual who has really low density in their bone, they will prescribe them a medication either by injection, by IV, or by a pill. We call them bisphosphonates. And the doctor gives them this anti-resorption medication so that their body is not going to shrink the bone away. Now, the side effect of that anti-resorption medication is that it also prevents bone from growing. And so when we actually go ahead and do an implant on somebody, we're counting on the body to grow bone around that implant. Now, if the body no longer grows bone, well, it's not going to grow bone around that implant. A couple of criteria for me that are more risk-based, which means they can still have an implant, but it's just the patient has to understand there's some risk involved in the healing and maybe the long-term outcome. One of them is a smoker. If they're a heavy smoker and they demand that they want an implant, I'm not going to say no, but I will let them know that smoking can cause the implant to fail 30 to 40% higher than a healthy individual. And an implant is generally maybe an 85 to 95% success rate. Age is absolutely a factor, and it's a double-edged sword. Before 18, your body's still growing. So if you put an implant, and if the shape of your jaw changes, then the implant doesn't fit you anymore. And so that's why we wait until we're at least 18 or a little bit older. A younger person in their 20s or their 30s, they're usually very healthy. So they're a great candidate for dental implants. A lot of times I tell my patients that if you're 30 years old, you're a good candidate and you're healthy, you're a good candidate for implant, but be prepared that 30 or 40 years down the road, there may be a possibility where this implant may have something going on and may needs to be serviced, or maybe a new implant may need to be put in.